Well, there's a lot of concern about the lack of water supply to hospitals in Johannesburg. Now, humanitarian organization Gift of the Givers is stepping in to help at the Rahima Moosa Mother and Child Hospital. The NGO is drilling a borehole to ensure the facility doesn't experience the same problem in future. eNCA's Slindelo Masigan has been following that story for us today. She's joining us now live from there. Good afternoon, Slindelo. Earlier, I saw your crossing with our colleague here, Tulasizo Simelane, when you were talking to a manager who was supervising the drilling of that hole. And what's of that borehole? What's the progress that they've been making?
Good afternoon, Bradan. Yes, we are still here at the Rahima Moosa Mother and Child Hospital, where the drilling process began at around 7 a.m. this morning. The site right now is still quite active, but the drilling process has been suspended just for a little while. We understand that there are some steel cylinders that need to be put in place. I'm just going to move out of shot so you can have a picture of what we're seeing right now. As you can see, the workmen are just taking a bit of a break because we understand that they have hit some aspects of water, and in order for the borehole not to collapse, they need to now put in these steel cylinders in order to ensure that the borehole does not collapse. But we understand that they are quite close in terms of getting to that borehole, and after that the processes of actually testing the water and ensuring that it's processed so that it can be consumed, that will then of course get underway. But at this point we understand of course that the hospital is still facing a massive water challenge, Bradan. I think you can understand just how critical and crucial this particular hospital is when it comes to providing services and primary health care to the residents here in the Johannesburg area, especially mother and children, those who are expected to give birth. In fact, when I was speaking to one expecting mother last week, she was describing a very harrowing experience, Bradan, of her experience here at the facility ahead of her giving birth, how the toilets were just so dirty, how there was blood on the floors, and that the hygiene was just not up to standard. And in fact, she was just grateful to be able to give birth and for her and her baby to make it out alive from this particular hospital. We also know, of course, that Rahima Moosa is one of the feeder hospitals that's taking care of patients also coming from the Charlotte Maxeke Hospital that's still temporarily shut down due to that fire that we saw a month or so ago. And so at this point, Bradan, we know that there are appeals from the hospital management, from companies and anybody really who can assist in terms of bringing water to the facility in order to alleviate that pressure. We know that clinical operations have had an impact in terms of the fact that some staff are unable to wash their hands. They're relying a lot on hand sanitizers, but washing of hands is still quite critical, especially now that we find ourselves and Gauteng back in a third wave, where I think the lack of water is now increasing that COVID-19 risk.
Yeah, I mean, that area where Rahima Moosa Hospital is in Johannesburg has got a number of suburbs around there, like New Clare, Bosman, Coronation, and it's a very important area in this part of Johannesburg. Is there any idea at all on the timelines? I mean, it takes quite a bit of work to drill a borehole, secure it, get water flowing out of it properly, the right pressure when you need it, and you need to pump it out as well.
Certainly, at this point, we know that the drilling process is certainly underway, Bradan, and in terms of the site manager on timelines, he can't really say definitely in terms of how long it's going to take. It's certainly not going to be completed by the end of today, but I think what's encouraging is that that process has already started, and what we understand is that there has also been a confirmation that Gift of the Givers will also be assisting the Helen Joseph Hospital, which is just down the road from here, with the borehole itself, in terms of some of the water challenges that particular hospital has also been facing. And we know that the boreholes will certainly be accessible, Bradan, to the communities, the surrounding communities, where we are expecting taps to be set up outside of the hospitals, that if there is ever another water crisis that the areas are experiencing right now, that the community members would have easy access to be able to get to these to the water that's expected to be in these boreholes.
Yeah, that's a very good move there, if they do get enough water from that borehole to support those neighboring communities of the likes of Bosmont, New Clare and Coronation. Thank you very much, Slindelo there, Masigane, giving us the latest what's happening at that particular hospital that's been lacking water for quite some time.